www.healthcmi.com. Acupuncture, continuing education online today. COVID-19 acupuncture and herbs outcomes reported. Coronavirus COVID-19 researchers conclude that the Chinese herbal patent medicine Lianhua Qingwen capsules decrease the number of virus particles in infected cells of COVID-19. So they used transmission electron microscopy to confirm that virus particles at cell membrane surfaces, the SARS-CoV-2 in the cytoplasm and in plasma vesicles, decreased in cells that were treated with Lianhua Qingwen. So that was in vivo. The herbal medicine results showed a morphological deformation of virus particles. So that's helpful in seeing some results. So we took a look at that research, and it looks pretty good. We also know that in other research, Lianhua Qingwen capsules do suppress pro-inflammatory cytokine expression, so TNF-alpha, IL-6, and things like this. So in cells infected with SARS-CoV-2. So some promising initial studies. We'd like to see some more on Lianhua Qingwen. Interesting stuff here. That herbal formula has your basic clear heat and toxin type of herbs, your Jinyihua, Lianchao, things like that, Forsythia, honeysuckle, but also has a very special high mountain Tibetan herb which helps with absorbing oxygen, which is a huge problem, Hung Jing Tian. So that is a clear heat and toxin category herb, but also Hung Jing Tian, this very special tonifying adaptogen, very similar in the sense that it tonifies qi like ginseng would give you some energy, but also has a clear heat and toxin property. So that's kind of interesting because at once you can fight the virus and also help with the fatigue associated with it. So a lot of the results in this research at healthcmi.com, you simply click on news and look for the article entitled COVID-19 Acupuncture Herbs Outcome Reported. A lot of it shows you what to expect if you add this herbal medicine into a treatment regimen. So fever goes away more quickly, coughing goes away more quickly, inpatient hospital time can be shortened, things like this. So it's a nice way to improve patient outcomes, both inpatient and outpatient care. Also, we have that in vitro work showing, actually in vivo using E6 cells. So we have that work showing how it has anti-coronavirus activity by inhibiting virus replication and reducing the cytokine release from host cells. So really interesting stuff. I want you to take a look. It's important because keep in mind, if you're in the hospital, they might give you some remdesivir, they might give you some oxygen, things like this. But some of these herbal medicines, the initial studies look very promising and they're non-toxic. So because the safety level is so high, first of all, there really isn't any harm in adding this to the treatment regimen. But more importantly, that the research shows that it can get results. And that's what I like about this. It's not surprising. In China, they had the 2003 SARS outbreak, that strain of coronavirus. And this type of herbal medicine also has been used a lot for things like influenza. So it's a broad spectrum antiviral. So a lot of hope associated with trying to get in there and just make things a little easier for people who are fighting this off. And certainly this herbal medicine shows promise. There's also some research showing that acupuncture helps the patients as well and can help alleviate some of the symptoms. So one thing that's interesting with COVID, people get that dry cough. This has some nourishing properties to deal with that, but also the severe fatigue, which is why this particular formula that they researched, the Lianhua Qingwen capsule, is so interesting because it addresses both the toxic properties and the febrile properties of this strain of coronavirus, but also the fatigue. So take a look. Thank you for listening. www.healthcmi.com